Wait, stop. Okay, I'll go instead of you.
Dr. Emer, you're live.
All right, guys, it's Filler Friday. You know it's our favorite day. Hey, guys, we're going to do female facial sculpting, and I'm excited about it because we have two beautiful females. We're going to start with our first one. She's always very nervous, so just let her relax, lay all the way back. I want to show everybody here because this resonates with a lot of my women that follow me online. She's very structured, but when you hit that age, and I'm hitting it too, in the upper 30s and beyond, you start to get a little bit of looseness in the tissue. Look at when I pinch the skin, look how loose it is, how soft, because she's very slim, she's petite, but she's got a lot of structure to her face. So what we need to do, if we're gonna use fillers, we're gonna do some shaping and such to make her a little lifted and a little softer. So we start from the top down. Women and men get a lot of hollowing in the temple. So one of the first things we're gonna do is inject Radius, which is a calcium-based filler, into. Now look, I want you guys to see something. This is touching bone. There's not much of the needle that's going all the way in. You've seen videos of mine where the needle goes all the way down. She has a very small space between the bone and the skin. So we're not gonna do as much as we normally would do because we're right at that edge of the bone. We're gonna go a little deeper in the temple and go all the way down. So we did both superficial and deep. All right. So look at that already. Just that little bit of volume already lifted the brow and improved the volume there.
How's it feeling?
I don't feel anything.
Good.
Okay. So if we're teaching, you can see the ridge of the brow, you can see all the veins coming through here, and this space right here at the lateral edge of the brow typically has an area where you can easily go in. Again, remember, a superficial part, not as deep, the needle's not as deep, going nice and slow. We're injecting in there. Just the only thing about it is that sometimes you hear it. You know, so now we're gonna go a little lower, go deeper in the temple, and give a little more support.
What do you hear?
Crunching, right? What do you hear?
It's crackling.
Crackling. So, perfect. Bring this over.
Somebody says that they need this.
Tell them what to do. Tell them how to get in.
Send us your info. Send us your info on a DM.
Tell them what to send.
Your name, your phone number, and your email.
And they can visit what website?
JasonEmerMD.com.
Perfect. So let's tell them where to go. Now to balance what we just did, we want to give her a little structure and lifting through the jaw. And we also want to lift a little bit in the brow and give her support. So we're going to do a little filler along here, very small amount. We're going to use Voluma. And we're going to go into the brow, right into the ridge of the brow. Just do a little bit because she's looking a little thin there, a little slim. Okay. You can see, look, it's just filling this out, giving a nice lift. Okay, it's wonderful. Perfect. And then I'm going to take just a small amount. We're going to press that right down. Look at that. It's great. We're going to turn her here. We're going to find the edge of the jaw. We're just going to do a little pinch, very little sliver right there. We're going to follow right along her chin, around her jaw, towards the chin. And we're just going to subtly enhance the line there, okay? Going a little superficial.
How long does this last?
This will all last about 9 months to a year, but you know how it is with fillers, guys. Within a couple months, everyone wants more. They always do. Because it's like, it looks so good, you know? Okay, we're just blending right here. Blending. Okay, you see how much nicer now? We're gonna then do a little more definition at the edge of the jaw, both a 90-degree angle. Okay, so take a look now. Nice and streamlined, defined, not overdone.
Still no pain?
What?
That's
So now
awesome.
we're gonna do that same thing. I'm gonna go over here, right up into that temple area, the superficial part of the brow, right onto there, nice and slow. Get that support. We've got a deep temple, superficial temple. Now we're doing the brow ridge.
And what about the downtime?
Nothing. She's going out tonight. She's ready.
Nice.
Got a big weekend ahead.
Very big.
Very big. We're gonna get a birthday to celebrate. Got a lot to do. She's gotta look good, so I gotta make sure that she's ready to go.
Please.
Guys. So we're doing nice little bits all on the jaw. Remember I said, we're just blending here, just blending. And this area is a little more full, so we don't do as much there. We're gonna come towards the chin. With her, because her skin's softer, we wanna be a little conservative with the threads, very small threads. Perfect. All along there. And again, at that 90-degree angle. We're gonna do our Q-tipping technique right on the edge here. Well, look, we're showing that perfectly. Look at that. Beautiful, nice and smooth, okay? Go ahead, Q-tip. Now, I know she doesn't like anything in the cheek, but because we want to blend everything, we want to keep it together, we want to lift, turn a little bit this way. This area here and this area here needs some lift, guys. They need it. So you see here, if we pull back, we do threads or lift, it's going to give her more. So we're going to do just a teeny bit to the apple of the cheek. Very small amount, 0.1, 0.2. It's not going to be crazy, I promise. We're going to work our way up. Very little. Because I want to give her structural support for lifting.
Are the results immediate?
Do you see them?
I do.
And they are. But what happens with fillers, you guys, you know, it takes about 2 weeks to see it all settle. And see, that's a nice subtle transition. See, just a subtle transition. And we're using one of my favorites, Volbella. No, what is this? Velour. You know that. Velour is a combination of Volbella and Voluma. It's a softer filler that also lifts. That's why I like it. But it's nice because look, this is a thin woman. We don't want her to look too structured and overdone. So we're using a softer filler to give her some lift and just doing very subtle. Okay, all pulling back, pulling back. Want to lift. Now this is what I call the without a trace lift, you guys. This is, she can go out tonight and without any trace that anything was done, a little Botox filler and some threads, maybe a little laser, and she's gonna look ready. Red carpet ready, gorgeous.
What is the Q-tip technique?
That's the Q-tip technique that I developed. It's to mold it all into the jaw and make it look super ready to go. All right, we make sure that everything's perfect. Just gonna do a little bit of this lateral hollow because this area tends to, but look at that little, okay, that's not overdone, right? That looks really good, right? So now, what?
Looks really good.
Looks really good. So now, we do need a little more structure on her chin area. Around her mouth is an important thing to her. Sorry, I'm gonna cut you off a little bit. So we're gonna use just a little bit of radius onto the bone itself to give her a little structure. You guys know I typically don't do this as much in women because it's a little more structured, but for her, she has a lot of more sagging. This is really gonna support her chin. Perfect. Looks great. Let's switch with you guys. We're doing a little filler dance. And any bruises, you guys, can be covered with makeup. We're going to do just a little bit onto the fold. And remember, one of the first fillers we ever did in clinical trials, besides Restylane, was actually a radius mixing study where we had radius for folds. It was very safe. And the right person, it looks great. Radius, which is calcium based, gives us a long-term improvement. So what I wanted to do was in the piriform aperture, a little bit in the deeper portion of the fold, just a little bit. Perfect. A little bit way lateral, a little lower right here, to give some lifting laterally. And then a little bit on the upper portion, turn here, on the upper portion right by the ear to give a little support to the jawline. Hold right there. Switch of view. Great. Turn over this way. Perfect. Just a little bit more laterally. Good. And today she'll look a little swollen. Tomorrow she'll be so happy. A little bit more to the fold here. Great. And a little extra, so why not? Teeny bit extra in the temple here. Okay, hold there. Good. And this way. And then a little bit on this side, you move a little bit more into the apple.
And again, how long does this last?
But you know, we talked about it. You guys know, you keep asking the same questions. So this will last 9 months to a year. Now lastly, we're gonna have the fun part. We're gonna go around the mouth, okay? So we're gonna work on a little bit on the corner and a little bit in the lips. And this is for some of the fine areas. So her lips, which are already beautiful, nice shape, they're just dry. We're going to do a few little baby injections, just very small. She doesn't want overdone. She'll go nuts if it's overdone. So we'll do half so you guys can see. Just a nice subtle improvement, okay? And this is for hydration. I'm going to do a little shaping of the lip. Grab that pillar. Let's put a little volume in that pillar. Okay, take a look at half. Let them see. One side, subtle plumping. The other side, not. So let's do that same thing down here now. Let's create that shape.
Do you guys have any questions?
Now's your time. Look at those beautiful lips.
It's such a beautiful shape already.
Doesn't it? I know. So we do a little on the crease.
Somebody says, come to Dolestown, PA. We need you.
You know it. Very soon.
Sorry.
Don't laugh too much. Now I'll change the shape. There we go.
If you need defined cheeks, just send us a DM with your info, your name, your phone number, and email, and then we'll call you soon.
Oh, we will. We
And which
will.
filler is this?
So we're doing a lot. We're doing about 8 syringes here, guys. We're doing full facial contouring. Yep, I know, but it's worth it. Blending everything. Let's make everything look amazing. She'll be super swollen in her lips today, but tomorrow she'll love it. So let's show her this. Wait, actually, sorry, let me do one more thing. We're gonna do number 9. So a little thing, these little wrinkles right here. Smile again, in this area. So we're gonna improve those a little bit by using a fine filler. Also, I wanna just soften the edge of this marionette. So we just inject very superficially right there and kind of cover up that little indent. There we go. Now smile. See these fine wrinkles? We just wanna do little blabs right under the skin with bilateral. This is our finishing touch. Just smile again. Good. This is our filler that fine tunes things. So we do Q-tipping on that. That's our Q-tip technique. Smile again. Great. So you see this fold, relax. Go right in the superficial part, get little blebs. This will hydrate and plump. Smile again. Good. Relax. Do a little into the fold.
And this is bilateral, correct?
This is bilateral. Correct. We're going to use a little on the marionette. Soften the chin. Always on this side, just a little to the eye corner, right in the corner there. Just get a little of that hollow. Folds look nice. Smile again. Almost no wrinkles now. Good. You see how that filled out that little space?
Mm-hmm.
Okay, let's finish that up over there. Ooh, we got a $20,000 facelift. Turn a little bit. Oh, yeah. We're just kind of softening all throughout the area, you guys.
What do you use for a deep marionette line?
We just did it, guys. So we did a little bit today. We did a velour, but typically you can use Restylane Define, Juvederm Ultra Plus, Restylane Lift, any of those that have a little structure. Voluma, which is we used in that area as well. Okay, so last part, lower cutaneous lip. Good. All right. So look at that blending. Look at that perfect blending. So hold on. Let's do an Emer reveal. Okay, you guys know how to do that. Let's set up the Emer reveal.
Okay, give
You
me
know
one
how.
second.
Get that ready. Now she's gonna look a little more swollen now. Cleaning her up.
Are you ready?
So, Emer reveal is you're gonna hold the cam and you're gonna take a look at what you look like and tell me how you feel.
All right, here we go. Emer reveal.
Except for the blood and a little bit of swelling. How does it look?
Oh my god. I love it.
Isn't it great? So what do you see? What do you love about it?
I love that the area of my concern, right around my lip area,
Mhm.
the chin, jawline. Oh my god.
Now, what do you think of having a little bit of cheek? Temple, look at the temples, look at the lateral cheek, under eye.
Yeah.
You literally lifted and softened everything. Everyone's saying you look good.
Oh, thank you.
And they're asking about the charge. Sometimes it's per area, sometimes it's syringe, but here we did sculpting of the lateral cheek, temple, and brow. Definitely define the jawline. Turn to the side, let's show everybody. Look at that,
I love it.
that chisel right there. All that. Now this skin will tighten, but now much better in the contour here. A little bit more softening the chin and the fine wrinkles, and beautiful lips. Look at those lippies.
Me too.
Happy birthday. Now wait, hold on, let's switch it back. We'll show you in the mirror. Hold on. All right, switch it back. I'll show her in the mirror. Everyone, she's turning 21 tomorrow, so
Yay!
happy 21.
Oh,
So
God, I
look
love
up, take a look. Now, what do you think?
You're amazing. Thank you.
You're
I love
welcome.
it. I love
So, you guys, that's the first part of Without a Trace. Now we're going to go to our Botox injection. Stay tuned.